About a year or so after I had Valerie, I lost a lot of weight, and the cup size just kept dropping and dropping and dropping, and now I'm an A. So obviously there's not a lot of structure left to my breasts, and I'm very self-conscious of them because I feel like they're shapeless. I'm very conscious of the way I look at the rest of my body. I'm constantly working out, and I'm trying to stay fit, and that's just one part of my body that it's not going to get any firmer with working out. Alrighty. I bought everything to change the shape of my breast. I bought, of course, all the creams that they say, are going to make your breast firmer. Skin firming cream, which doesn't do anything. I've done tons of push-ups, which, have helped my shoulders, but they really haven't done much for my breasts. There's nothing there. This is my lovely collection of padded bras. This is one of my favorites because it is black, and it's completely formed, so I don't really have to have anything to put inside, and it just kind of makes me look like I have nice breasts. This bra is very fun because it has a little air pocket in it, so you can kind of give yourself a little lift. And actually some of them have these little pads inside that you can actually remove. But I mean, look at this padding. I mean, that's a whole implant in there,
Hi, Allison. How you doing? Good. Okay, so I'm going to examine you now and go over your findings with you, and we'll talk about your options, okay? She, like a lot of women, has had changes in her breasts since her pregnancy. The breasts got larger during the pregnancy period, and now they're smaller and they're droopier. And Allison, like a lot of women, has come in asking me to give her breasts back and to restore the shape and the size that she once had. So you can see that your nipples are a little bit lower than your fold, and the left is a little lower than the right. Okay? Now I'd like to examine your breasts for any breast masses. Do you do breast self-examination on a monthly basis?
I do.
That's good. Any family history of breast cancer?
My grandmother.
How old was your grandmother when she had breast cancer?
She was about like late 60s, early 70s.
So we can agree that she was postmenopausal, correct?
Definitely.
Is she still alive? Did she pass away from breast cancer?
Yes.
I would encourage you to continue doing breast self-examination and get mammograms.
But what about with the implant, getting a mammogram?
We're putting the implant behind the muscle, and we're shooting one additional shot for your mammograms called an Eklund view, and that allows us to look around the implant and see the breast tissue itself. So I know it's very exciting, and you must have many questions. I'm going to let you get dressed, and then we'll talk to you in my office, and you're welcome to bring your boyfriend in.
Definitely will.
Okay, see you in a few minutes.
Thank you.
Why don't you go ahead and get dressed?
Okay.
Allison is an excellent candidate for this surgery. She has reasonable expectations, and she has something we can help her with. You getting excited?
I'm really excited.
A little nervous, too?
No, I'm not nervous at all.
That's great. How about you?
I'm nervous.
You're nervous? And there are a number of examples here. This is before and this is after. This woman is a 34B to start, and now she's a 30, sort of B minus, and here she's a 34C. So do you like the size?
Yeah, that looks really good. I mean, my main concern is having it be proportioned with my body size. I mean, I'm short, I'm small boned, so I don't want it over exaggerated, but I definitely want something bigger and fuller.
Okay, if we saw your breast on cross section here along a lateral view, we'd have the outside of the breast, and then we have the muscle. And this is the pectoralis muscle. When we put the implant in under the muscle, it goes right here. We come in from the side and we actually put the implant behind the muscle after we've made the pocket. The advantage of me putting it behind the muscle is that you won't feel the implant as much, and the mammograms are easier to read since there's a partition in the muscle over the implant. Does that make sense? Do you have any questions about that at all?
I don't think I do. I think I'm all set.
How about you, Adam?
No, I think you've covered it.
Well, good. I will see you at surgery then.
All right.
Good seeing you.
Much.
Thanks for coming in, Adam.
Thanks, Dr. Stevens.
What I'm doing now is once again measuring where your nipples are and reconfirming how that relates to where the fold is. Do you have any questions for me at this point?
I'm just prepared, and I'm just trying not to really think about this whole procedure. Just getting it done and being happy afterwards.
Okay. How's Adam doing?
I think he's nervous.
Yeah, he's probably more nervous than you are.
Yeah, he is. I think you put an antibiotic in there, and then now I'm just sitting here getting nervous. I want it just to happen already so I can stop being nervous.
Hi, are you ready? Have you met Carol?
Through your IV to relax you.
Super.
Just take some deep breaths, relax.
You promise I'm not going to wake up in the middle of this, right?
You will not wake up in the middle. You'll wake up afterwards.
Okay. Like in 2 days, right? Yeah.
I think that there's no such thing as minor surgery, and every surgery has challenges to it. This is not anything out of the usual, and I'm confident that she'll be very happy with the outcome.
Okay, Allison, this may be anesthetic. It may burn a little bit in your right arm. We'll take good care of you. Pleasant dreams.
Thank you.
Okay. I'm injecting the local anesthetic in the area where the surgery will be done. This reduces the blood loss or the bleeding. I'm measuring some marks that I made on her nipple, just reconfirming. We subscribe here to the Carpenter's rule. The Carpenter's rule is measure twice, cut once. Okay, what I've done here is made one of the incisions in preparation for the augmentation. Okay, I'm dividing the breast tissue now, trying to get down to the level of the muscle, the pectoralis muscle, which I will be entering just a moment. Okay, I'm under the muscle now, and I'm creating that pocket where the implant's going to live. So I'm putting the implant in. There's 50 cc's in it right now. I'm going to place it into the pocket. I roll it like a little taco shell. Okay? And place it through the incision. There we go. Something like that. And now I'll put in sterile saline. This is the same saline that goes into your veins if you're having an IV. The breast tissue is now being closed or reapproximated. So what do you think, Isabel?
I think it looks beautiful. She's going to be very happy with this busting perky bee.
Okay, she's going to prepare the next implant. I'm going to go to the other side, and I'm going to do it again.
Hopefully everything went real well, and we'll find out pretty soon.
Yeah? It's all done. It's finished.
Open your eyes.
You did it.
Can you open your eyes? There you go.
Oh, that perky boobs.
Hey!
Allison looks great.
Yeah?
I just talked to her.
Went all right?
Yeah, it went super. She looks beautiful. She's comfortable.
She gonna do like a recovery process now? You're in a special room or something?
She's in a recovery room right now, and she'll be there for about 45 minutes.
Okay.
And we'll get her up, and we'll give her back to you. And you can take her home and tuck her in.
Okay, great.
Okay.
Cool.
Any questions?
No, appreciate you coming out.
You bet. My pleasure. See you tomorrow.
Thanks.
I'll call you tonight.
Okay.
Make
yeah,
sure she's all right.
Please do.
Okay.
Thanks.
You're welcome.
I'm anywhere between a B and a C, very small C, large B. And that's exactly what I asked him to do.